Hi, my name is Stephanie Azulawaga, and today I'll be performing mechanical traction on a patient with osteoarthritis localized in the L4 and L5 area. The contraindications for traction are acute injury or inflammation, where motion is contraindicated, joint hypermobility or instability, uncontrolled hypertension, or peripheralization of symptoms with traction. The precautions are claustrophobia, a disoriented patient, a patient who is unable to lay prone or supine, severe pain that is fully resolved with traction, medial disc protrusion, a displaced annular fragment, if the pressure from the belts may be hazardous, or if there's a structural disease or condition that affects the spine. Today I'll be performing mechanical traction on a patient with osteoarthritis at the facet joints localized in the L4-L5 area. For this reason, I will have the patient supine with the hips flexed, and we will get this by placing a stool at the knees, which will also create a lumbar flexion. The benefits of this treatment are to have a well-controlled traction force and time, a longitudinal pull to decrease the pressure, and a distraction force to create a distraction of the facet joints, and as well as increasing the soft tissue extensibility. Prior to the patient getting on the table, I want to make sure that it's locked, which it is now. I'll have you go ahead and lay down for me. Alright. I want to grab the stool and place it here for the patient. There you go. Go ahead and place your feet on there for me. Alright, that's good. And now I will apply the thoracic belt first. I want to make sure that I feel for the iliac crest right here because I want that to be superior to it. I want to make sure these belts are nice and snug so that the patient also feels comfortable. Palpate the iliac crest and make sure the lumbar strap is encompassing it. Good so far with that. Now I can place the lumbar straps through. I can place these belts through the straps. I want to make sure that this O-ring right here is going to be right in the center because that's where the J-hook will insert. So I can see that that's right in the center. Just to make sure that this is nice and snug. How does that feel so far? Good. Alright. Now that's on there, I can insert the J-hook right into that O-ring. Alright. Now I can release my rope. Now I make sure that this rope is nice and taut again, so I just press the spine. Prior to the treatment starting, I also want to hand my patient the call button to make sure that if anything goes wrong, she can stop the treatment. And I want to make sure I unlock the table in order for the distraction force to actually be applied through. Also, once the treatment is over, I want to make sure that the table is locked and that the patient gets up slowly as they may be dizzy from the treatment from being laid down for a period of time. So we're going to set it for lumbar traction. We're going to hit edit. The treatment time is going to be 15 minutes, as is the patient's first time. It's going to be 40 pounds, since it's the first time as well, and we'll set the minimum to 10 pounds. Once the patient has gone through further treatment, we can increase it to 50% of their body weight for joint distraction. And we'll set the hold times for 15 seconds, and for relaxation for 15 seconds as well, as these are the parameters for joint distraction. And now we can start the treatment. The expected outcomes of the treatment are to decrease pain and stiffness, increase joint mobility and range of motion, which occurs through the lengthening of the soft tissues of the spine with the force that is provided with the joint distraction.